Hello and welcome to this short brief on Foundation Medic. We're going to introduce some of the themes and topics to you that's changed from the previous course. So you'll hear things like educational supervisors. These are the team that support the trainee outside of the classroom, support them, giving them direction, confidence, and further learning opportunities. You're also going to hear about the review panels, what they consist of, how they change the dynamic of the course. You're going to hear about the length of placement, which has increased for the joint environment. And you'll hear more detail from the instructors about their single service elements. Additionally, Foundation Medic is a course. The change is to the delivery, not to the overall capability, which is fully customer agent endorsed.
I think the big bonus from my point of view is the secondary healthcare and primary healthcare placements that they get at the end of Foundation Medic now, which is a full 12-week package where they would usually just get a primary healthcare med centre placement. They now go to secondary healthcare and they'll see a lot more acutely sick patients in the secondary healthcare setting, and they'll hold on to these patients for a period of time, as we wouldn't do in the past. We tend to have them, send them back out to work. Now we hold them in hospitals with the scope of operations at the minute. Medics will have to hold patients for a lot longer, so it can only be a bonus that they're seeing that in real life. They get opportunities to go to RCDM or the 4 JHGs that are on offer.
Okay, the new Foundation Medic course is a 6-month course. 50% is assessments and 50% is placements. There was a review throughout the course with a review panel, which is made up from OC Phase 2, OIC Foundation Medic, which is myself. You have a member, an independent member. You have a member from the learning support, and also you have a member on the panel from the validation and training department. So what's discussed at the review panel? It's when the board comes together to discuss the trainees on the course, looking at their overall performance so far, looking at their formative assessments, looking at their performance within the CPD-ME, and then it's discussed if there's any issues before the trainee moves on to the next part of the course.
So the assessment criteria has changed slightly, and we look more at a competency-based assessment now. So that includes, as well as the traditional theory assessments, it also includes then some more skills-based work. So we do OSCEs, so objective structured clinical examinations, where we look at trainees undertaking specific skills. This is a little bit more flexible. It allows us to see the trainees in different environments, and it also allows us to get a better understanding of their actual understanding of the topic. We also utilise CPD-ME, which many professionals have used in different settings, and we are now using to allow our trainees to reflect on their work and upload documents and evidence to help show that they have learnt what we've taught them and that they've taken it on board. So they do this from day one throughout the training and also whilst in practice. And they can take that forward as part of their lifelong learning into the real world. So competency-based assessment allows us to assess trainees in different ways. In the past, it's always been a pass or fail, a cliff edge assessment. We wanted to make that more flexible to allow our trainees to show and demonstrate the skills and knowledge they have in different ways. This supports people who learn in different kind of ways, but also people with specific learning disabilities, for example, and allows us to get a better understanding of their skills and competence. So we do this in numerous ways, including a case study assessment where they're given a scenario of a patient and they have to explain what could possibly be wrong and what treatment they would provide, but also in skills sets. So using OSCEs, objective structured clinical examinations, to look at whether or not the students understand how to do those specific skills. So that would include things like blood glucose monitoring and a full set of observations.
From the start of Foundation Medic, the trainees are integrated into their respective single services a lot earlier. So they have that integration with the single service staff to keep their service identity. For example, in the Royal Navy, they are classed as medical assistants a lot earlier, and we give them that identity. What we do then is we take the training they are learning in the tri-service environment, they come to us and we adapt it to how it affects them in the single service part of their career. So when they leave here, they are more equipped to whether they've gone general service, submarine service, Royal Marine Unit,